Why do normal brain scans sometimes look like tumors? Imagine looking at a brain scan and seeing what looks like a tumor, but in reality, it's not. This can happen quite often and is a common challenge in medical imaging. Brain scans like magnetic resonance imaging or computed tomography are powerful tools, but they are not perfect. Sometimes they show features that resemble tumors, even when there is no cancer present. Understanding why this occurs helps us appreciate the complexity of brain diagnosis and the importance of careful interpretation. One reason is that some non-tumor conditions can produce lesions or masses that mimic tumors. For example, bleeding inside the brain, known as hemorrhage, can appear as a mass on scans. Over time, these blood collections can change in appearance, sometimes showing contrast enhancement or swelling around them, which are features often associated with tumors. Infections or inflammation in the brain can also cause swelling or abnormal tissue that looks like a tumor. Vascular malformations, which are abnormal blood vessel formations, may also present as unusual masses. These conditions can sometimes be mistaken for tumors because they produce similar signals on imaging. Another factor is the presence of imaging artifacts or normal variations in brain anatomy. Sometimes, calcifications in the brain, which can be harmless or related to other conditions, appear as dense spots on scans. Without detailed analysis, these can be misinterpreted as suspicious growths. Technical aspects of the imaging process, such as the angle of the scan or the quality of the image, can also create artifacts that look like abnormal masses. Swelling or mass effect caused by trauma, stroke, or infections can also distort normal brain structures. This displacement or compression of tissues can resemble the effects of a tumor, especially if the swelling is significant. Because tumors often cause similar effects, distinguishing between tumor-related and non-tumor swelling requires careful analysis. The imaging characteristics of tumors can vary widely. Some tumors are cystic, meaning they contain fluid, while others are solid. They may enhance with contrast agents or not. Other conditions like abscesses or blood clots can also show similar features, such as contrast enhancement and surrounding swelling, making it tricky to tell them apart from tumors on initial scans. No imaging technique is perfect. Magnetic resonance imaging and computed tomography each have strengths and limitations. Sometimes, additional advanced imaging methods are needed. Techniques like susceptibility-weighted imaging, diffusion-weighted imaging, or magnetic resonance spectroscopy can provide more detailed information. These help differentiate true tumors from other mimicking conditions by analyzing tissue composition, blood products, or metabolic activity. In clinical practice, doctors don't rely solely on imaging. They consider the patient's symptoms, medical history, and physical exam findings. For example, sudden neurological symptoms might suggest bleeding rather than a tumor. Combining imaging results with clinical information improves accuracy. Sometimes, further follow-up scans are necessary to see how a lesion changes over time. If uncertainty remains, a tissue biopsy might be performed to obtain a definitive diagnosis. This is important because treatment decisions depend on accurate identification of the lesion. In summary, normal brain scans can sometimes resemble tumors because various non-cancerous conditions and technical factors can produce similar images. Correct interpretation requires a combination of advanced imaging techniques, thorough clinical assessment, and sometimes additional testing. Always consult healthcare professionals for personalized diagnosis and treatment options. Remember, each case is unique, and careful evaluation is key to ensuring the best brain health outcomes.